Our research has highlighted that refugee and asylum-seeking women experience particular problems with health and legal service provision, and given their immigration status, these are the services which make the biggest difference to their asylum claim itself. So they are particularly crucial when it comes to the whole experience of living in the UK. The key research findings of the project include the importance of building trustful relationships between refugee and asylum-seeking women and practitioners, the importance of time in those appointments, especially when it comes to health and legal service providers, also the importance of gender. Some women do not feel comfortable with male practitioners due to sensitive nature of their experiences. And last but not least, the importance of human rights principles such as fairness, dignity, and equality. The main issue that refugee and asylum-seeking women face when it comes to accessing health services is the issue of access itself. Quite often there are problems with registering at the GP practice. The people at the reception and sometimes the GPs themselves don't understand that women are actually entitled to healthcare in the first place, and they ask them for documents which they simply do not possess.
I would like to register, please.
Okay. Do you have passport?
I'm an asylum seeker in this country. I don't have a passport yet.
So that's the problem, you don't have passport. So you can register.
I still have to travel all the way to my GP because my local GP couldn't register me to, because they're asking for a proof of bill, a passport, and a benefit letter, which I don't have.
Another problem that refugee and asylum-seeking women have described is consistency of GP care. The fact that they often have to change their address, and every time they change their address they move to another GP, and they have to recount their often very traumatic stories once again, and they find it extremely difficult. And they also feel they are not able to build trustful relationship with a new GP all over again.
You have to be able to trust your GP. So for that, it doesn't mean that it has to be many of them, to see many of them or changing them all the time. So you have to have like a GP that can see you almost every time that you have an appointment. So yeah.
For quite a few women, even those who have been in the UK for quite a few years, it is still difficult to express their health problems in English, and there seems to be no provision of professional interpreting services available at certain GP practices. And some of the women are, for example, asked to come along with their friends or even their children to GP practices, which is not appropriate, because then the issue of disclosure of sometimes very private and difficult health-related problems becomes very challenging for those women then.
How can I help you today?
Yes, I have a patient who's French speaking, so I will interpret. Donc, qu'est-ce qui se passe? Quel est votre problème?
Le problème avec moi, c'est que depuis que je suis ici,
The first time I went to the GP to see my GP to talk about my gynecological problem, because I wasn't speaking the language properly. It's gonna advise an interpreter. I had that interpreter over the phone, and everything that I was saying is not translating exactly, and the doctor was saying that, oh, so I had a fibrosis. After that, the interpreter finished saying whatever he wanted to say to the doctor, and I said, no, the interpreter didn't translate exactly. I'm not suffering for anything else. I think it's a fibrosis, but it's not like the thing they think is cancer or something that I need to go to do a scan or biopsy. So I was really, really shocked.
Regarding the gender, I'll just go for, and I think it's a little bit hard when you is an opposite gender, like a GP who's an opposite gender to you. It can come across a bit intimidating and also like embarrassing sometimes to explain everything.
And also, from what I understood, she is experiencing some health problems as a female, as a woman.
So can she be more specific what those problems may be?
Quels problèmes vous avez avec des choses?
Le problème, c'est que quand j'étais à mon pays, là-bas, j'ai été violée. Oui, j'ai été violée. Depuis là, ça m'a rendu un peu... c'était un peu difficile pour moi, vraiment. C'est une chose que je ne peux pas jamais oublier.
Well, the problem is that she was raped back home. You know, it happens in Congo all the time. According to Refugee and Asylum-seeking women who were interviewed for our project, there is lack of understanding of their own rights and their entitlement to legal aid. Quite often women rely on advice given by their friends, which is not always accurate, and this is made even more difficult in the context of current legal aid cuts.
When I went there, they asked me, "Oh, are you working?" And I said to them, "I'm not working." And they said, okay, they have to take some information to see if I'm eligible for legal aid. So they did the investigation and they said, okay, you are eligible for it. And they took my case on. Okay, if you are not able to receive legal aid, you have to pay for it. And being paid for it before they can even talk to you, they will charge you consultation fee.
Majority of women in our sample complained about the experience of contacting their solicitor. Quite often they don't reply to the messages, they don't call them back, and as a result women feel that they are not properly looked after, and this is made even more difficult in the context of dispersal out of London, and also when women are detained in immigration removal centers.
First of all, why I left several messages, I sent you an email and you never called me back. Why?
Really? Well, I've been quite busy at the moment because I have too many cases.
One of the problems as well, especially if you are in detention center, is really difficult to communicate with your solicitors. First of all, you're locked up, you can't pop in their office to see them, you have to fax to them, or you have to give a phone call. In detention center, we don't have money, we don't have phone cards. So sometimes the 75p that they give every week, we have to save for a week to get £2 to buy a phone card to phone your solicitor. And the solicitor is not even bothered to call you back to say that you're in detention center.
Our study found that in most of the cases there is no childcare provision for asylum-seeking and refugee women when they go to see their solicitor, and they find it extremely disruptive when their children are present at those appointments, and if especially if they are also asked for help when it comes to interpreting.
If you go, for example, in my case, I've got my daughter with me. Every time I go to the GP, she's disturbing me. And it's quite distracting, is make me a little bit nervous because I have to look after her, to hold her and talk to the GP at the same time. Or if you had enough, I put her down, she'll be running around in the room, and the doctor can be annoyed as well if they can find even a place in the surgery for the kid to be kept while you're having an interview with the GP will be good as well, because when this kid are around, you are not concentrating.
What is unique about our project is the fact that it is user-led. So the key research findings identified by the women themselves are used as the basis for a training program for practitioners who work with this particularly vulnerable group. We would like to encourage you to sign up to our training, and more information is available during the conference.